Oh. Can see it? দেখতে পাচ্ছ? হ্যালো হ্যালো
হ্যাঁ স্যার দেখা যাচ্ছে।
ঠিক আছে। Last class we discussed about the carcinogens. Now with the last portion of these topics, the which classes of the chemicals and to be carcinogens. I think this was discussed. Okay, এটা হয়েছিল epoxide, ethylene oxide, propylene oxide, and halogen compounds like vinyl chlorides and hydrogen dimethyl hydrogen nitrous compound. হ্যাঁ হ্যালো
কিছু ক্লাস দেওয়া হয়েছিল স্যার ইপক্সাইডস আর ইয়ের উপর।
হয়ে গেছিল এটা?
না
হ্যাঁ হয়ে গেছিল।
ক্লাসিফিকেশন তো হয়েছে। হ্যাঁ হ্যাঁ
এইটা
হ্যাঁ স্যার এগুলো বলা হয়েছে তো।
ওকে এইটা
হ্যাঁ হাউ এন্টার হ্যাঁ বডি ট্রান্সমিশন এটা তো পড়া হয়েছিল।
হ্যাঁ হ্যাঁ এটা জাস্ট ফিল্মসে হয়েছিল। Next, what are the organs to be carcinogen and attack mainly? These are the organs. Just today discuss from this. Actually, whole of the body are prone to carcinogen or produce some cancer disease. But generally, these are the organs which are affected by the cancer disease like lungs, liver, and kidney, and reproductive system, skin, and many other organ and tissue. So, what factors influence the development of the cancers? Obviously, the carcinogen, but how it will be? What are the mechanism? The dose. First of all, the dose, the amount and length of the exposure. Sometimes the carcinogen which are exposed, but this is not true. This person which are can produce cancer because certain criteria there is a dose and amount, the amount and length of exposure. Which amount will be exposure and what time will be the exposure? Depend upon this, the DNA can be changed or the person can be affected. So not only that when it is exposure with the X-ray, that means the cancer will come. No, the dose, amount and length, what times and length of the times and what amount of the carcinogenic introduced into the body or the exposure by the body. The lower the dose, the least likely you are developed a cancer and related disease, obviously. And the time the exposure time is the high, then the chances of cancer, the environmental or the lifestyle factors like cigarette smoking. Suppose one day you take one cigarette, but there is no chance of cancer. But a long time or chain smoker, the co-carcinogens, alcohol consumption, co-carcinogens, and diet also. There is some diets, the high fat diets, consumption, and natural antioxidant and geographical location, industrial area, euphyllite, and hyper. And also one foods, amanita phthalates is mushroom like foods, is a very delicious food which causes cancer also. And therapeutic drugs sometimes known as the carcinogenic, say for example diethylstilbestrone and some hormonal therapy which also causes the cancer. So these are the agents which causes cancer, not only the carcinogen but also that depend upon their amount and the length of the exposure where the person will be exposed. And how do I reduce my exposure to the carcinogen? How to reduce to exposure of carcinogen? Number one, engineering control. That means you some prevention, you work in the radiation industry or you work in the asbestos or coal industry. How to will we prevent or control? It control exhausted the ventilation and equipments, personal you protect yourselves, exhaustion ventilation is high, and equipment personnel and protection of the equipments. If they are not exposed, there is a minimum exposure, that's why you can apply some engineering controls, and obviously the company as well as the personal protection, that will be less chance of exposure and the less chance of cancer. Another is a personal hygiene. You maintain your personal hygiene, you shield your shielding agent or others that can be prevent the cancer, affecting the cancer. Labeling and storage of container and housekeeping. Labeling and storage, the housekeeping material which are carcinogenic, that will be labeled and that are not touched with the, and that's you can prevent the carcinogens. And the maintenance and regulatory area, obviously this area there are where the carcinogenic product are used, that may area will be maintained and clean up properly, then there is a no minimize the cancers. And then decontamination and the emergency procedure or monitoring and administrative control. Obviously there is some admission, there is some instruction given to the worker or any other person to avoid this area or to protect yourself to contamination of carcinogens. Engineering control exhaust the ventilation and the equipments. Say for example the fume hoods. Nowadays there are in case of chimney or here use the fume hoods full open phase velocity 80 to 100 fmpm full parts minute, and local ventilation exhaustion at the point use the local exhaustion, the fumes will be fume and it will be or elephant trunk, also slot hoods, and carcinogen gloves box or environmental chambers or biosafety cabinet. These are the chamber you can use it under the anti-cancer drugs and viruses, and no benchtop work in this laboratory setting. So these are the criteria you can maintain it to avoid the exposure of carcinogens. Another is the personal hygiene. If you maintain this personal hygiene, I think it will be reduce the cancer. No smoking. No smoking, eating, drinking or application of cosmetic is permitted in the area. Don't suppose, say for example, some use some creams or the foods which are this color is very carcinogenic. You can avoid this. I think it will be no problems in the or chances of cancer. Where the carcinogens are each used in any lab area, and no much by pipetting and washing hands and exposed skin in the potentially contaminated face, neck and forearms. So these are UV sealed or covered up. There is no chance of attack and no shot and open to sew and remove the lab coat and other potentially contaminated protective clothing before leaving the work area, or lab coat need to cleaned and regularly, and special washing instruction may be needed, and contaminated disabled clothing should be treated as a hazardous waste. So there are personal hygienes and you can use some clothes and covered with the body. I think it will be reduce your contamination or carcinogens. How do I dispose of the waste of carcinogen? The carcinogen waste material, how to dispose it? This is another thing. There you will work in the laboratory where the carcinogen compounds. This carcinogen may be never be disposed on the ordinary trash because it will be produced in the environment and it is discharged to the sanitary sewers, and the waste bottle must be properly labeled and tightly capped and at all time except when adding or removing waste, and they must be secondary contaminated. So in case of a laboratory or waste material can be disposed by the sanitary sewers, not only exposed in the environment, that will be producing another carcinogen others person also. So carcinogens and the chemical carcinogens. What are the different class of chemical carcinogen? Especially these are the agents which are produce the carcinogen. The aromatic hydrocarbons like benzopyrene, which is present in the cigarette, tobacco, coal tar, smoke. These are the aromatic hydrocarbon which are produce some cancer. Aromatic amines like azo dye, all basically the all dyes are the carcinogen. But azo dye, which are specially for produce a carcinogen dye, and beta naphthalene amine, acetylamide fluoride, and naturally occurring aflatoxin. A aflatoxin is a food or betel nut, which is produced of cancer, alpha aflatoxin, or the ornithophalloids like mushroom like foods that also produce sometimes cancer, and some miscellaneous and also some drug therapy, basically for the hormonal therapy. These hormones are produced sometimes cancer, prostate to breast cancer. The vinyl chlorides and asbestos in carbon monoxide. That's why the carbon monoxide, the pollution will be controlled by the government due to carcinogens. Apoptosis. Obviously, this I think discuss this topic in elaborately in the next class. The apoptosis. Apoptosis is the programmed cell death. Programmed cell death. The cell will be differentiated, development, and finally death. This is the normal process, and the time is required. At a specific time is required, but before this time, it will be problem, or it is longer the time, that will be problem. But at the proper time, that will be no problem. So at dropping or falling of a normal program, dropping or falling of a normal programmed destruction of the cell during the emergencies and development of the adult life. This is the called apoptosis, and destruction of apoptosis promote inappropriate cell division, cell survival, and development of cancer. Actually, your apoptosis is regular, there is no chance of cancer. If it is not regular, if not regulated, then the chance of cancer. We are discussing in the later class on the basis of the apoptosis. Basically, the promote Proto-Oncogene and the tumor suppressor gene. Proto-Oncogene, the normal gene, stimulate the cell division, as Proto-Oncogene, which activate by the physical or by the chemical agents or the biological carcinogens, they activate the oncogenes, and that oncogenes which increase the growth factors or secretion some proteins, and growth factor receptor signal the transcription mechanism. Ultimately, the cell division will be the faster, and the tumor or neoplasia will be occur due to proteogene activation, or proteogene activate the oncogene, and finally the tumor or neoplasia will be appeared and cancer will be produced. Another gene is the tumor suppression gene, which is inhibit the cell division, and the normal cell balanced activity of the tumor suppressor gene and proto-oncogene activity. Proto-oncogene activators genes control the normal growth and repair, neoplasia uncontrolled cell division or decreased suppressor activity. Sometimes neoplasia due to decreased suppressor activity or increase the proto-oncogene activity. Think it will be a neoplasia, that means tumor can become either the decrease the suppressor activity of tumor suppressor gene or increase the activity of proto-oncogene activity. Ultimately, the cancer will become. Oncogene expression. The proto-oncogene control the normal growth and cell division, and mutated version of proto-oncogene as a oncogene. That means it produces cancer. For example, that means mutated version of proto-oncogene. Proto-oncogene is a normal cell division, but when it is mutated, why mutated? But it is mutated by the exposure of some physical, chemical, or some biological agents. That will be exposure on the proto-oncogene activate if any chance by anything it expose or activate the proto-oncogene, it is converted, or mutated proto-oncogene is nothing but a oncogene, and that oncogene produces growth factors, growth factor receptor, protein involved in the signal transduction, protein involved in the signaling gene expression in nucleus, and some growth factors including the growth but not cell division. And 50 types of growth factor is identified, that first platelet dividing and growth factor PDGF. So these are the factors which can activate it or aggravate with the influence of the oncogene, and finally the cancer will become. This is the mechanism of activation of proto-oncogene to oncogene. How it will be activated? Especially the promoter and enhancer insertion. You know it, in case of the protein synthesis, promoter is the main role, and along with this some enhancer molecules that promotes, or it is inserted into the DNA sequence that produce the activation of proto-oncogene, or chromosomal translocation. The chromosome, normal chromosome, if it is translocated, then the activation of proto-oncogene, or another mechanism gene amplification. Suppose the gene is the normal gene, but when it is amplified, the gene sequence is altered or addition. they are the amplification of gene, it produces sometimes mutation. And another is a point mutation. Oh, here point mutation देखो depurination, deamination, TT dimer, AT or TT, that is them. In case of skin cancer or multiple myeloma due to UV ray, that line not, it is a example of point mutation and that produce a cancer. Effect of the oncogene on growth, and putting on foot an accelerator of the automobiles. Putting on foot an accelerator of the automobiles. Actually, automobiles, they produce some gases that produce some cancer, and tumor suppressor gene taking one foot from the brake. These are very good examples. Effect of the oncogene on the growth, putting on foot on the accelerator of the automobiles. When effect of the oncogene on growth, just like accelerator part press করলে যেটা হবে, টিউমার সাপ্রেশন যেটা করলে জাস্ট লাইক ইট ইজ ব্রেকের ফাংশন করে। তার মানে ক্যান্সার প্রডিউস করতে গ্রোথ ফ্যাক্টরটাকে অনকোজিনকে অ্যাক্টিভেট করা, অ্যাক্সেলারেট করা, মানে অটোমোবাইল অ্যাক্সেলারেট করে যেমন গাড়ি চলবে, তেমনি অনকোজিনকে অ্যাক্সেলারেট করা মানে টিউমার হবে। আর টিউমার সাপ্রেশনকে যদি প্রেস করো তাহলে put on the tumor suppressor gene talking 1 foot from it's like a break. That means to stop the cancer. Like the clinical tumors markers, the lung cancer, these are the marker, liver cancer, APTF, and details. This is the details in next. The definition, the biological substance, the tumor marker, that means which material or which is the identified marker by which you can identify it is a cancer different organs or area. The biological substances synthesized or released by the cancer cell and found in the increased amount in the blood, body fluids and tissue, and indicating the references of cancer. So these are the marker. Nowadays there's so many marker which is detect very earlier in cancer, and if it is they are detected earlier, then it can be prevent faster. The application of the tumor marker to diagnosis, differential diagnosis, stage of cancer, which stage, 1, 2, 3, 4 stage, and detection of the recurrence, if it is recur or not, that means, and monitoring the response to the therapy of prognosis. This is the tumor marker. Involved in the markers like enzymes in case of the prostate acid phosphatase in case of prostate cancer, alkaline phosphatase, bone carcinoma, and in case of proteins, the prostate specific antigen PSA, prostate cancer, multiple myeloma, serum protein, albumin, immunoglobulin or benzene joins proteins, C peptides, nowadays the C reactive proteins, or inuloma, and in the beta microglobulins, beta cell of lymphoma. And in the case of carbohydrate, especially chemically 3 components, one is the enzymes, on the proteins and the carbohydrate, but which is present in the where, and that will be identified and it is estimated. Finally you can identify, confirm that it will be which type of cancer. যেমন carbohydrate antigen CA125, CA125, it is a ovarian and endometrium carcinoma, and carbohydrate antigen 549, which is the breast and ovarian cancer. So carbohydrate can produce cancer, but the CA129 and CA549, this is the marker for the this type of cancer. You can identify diagnosis from the diagnostic laboratory, and if it is exceed, then it is ovarian, and chances of ovarian endometrium cancer or the breast cancer if the CA549 is increased. Tumor markers, the hormones either in the metabolic beta CCCG, hormonic human chorionic gonadotropic hormone, or cornea carcinoma, and calcitonin, medullary carcinoma, and vinyl, and these are the pituitary prolactin in case of pituitary adenoma, and oncofetal antigen also, alpha fetoprotein. This is the most important marker for tumor to identify the tumors, alpha and carcinomyoglobin antigens. These are the colon, lungs. Cancer and the diets. Cancer and diets. Sometimes some diets are causes cancer, and sometimes some diets also reduce the cancer. Increase in the animal fat which causes cancer, increase in the bacterial flora, and conversion of the acid and sterols that produce carcinogen. But beneficial role of the vitamin C, E, and selenium. Some foods causes cancer and some food decrease the cancer. Beneficial role in the vitamin C, vitamin E or vitamin A or selenium and beta carotene, that is vitamin A, and traces element like manganese, zinc and selenium and copper, which reduce the cancers. Cancer therapy, obviously the chronic myeloid leukemia. This is a very good, I think, details on the cancer therapy, but you are not depend upon these slides. Cancer, this oncogene, ABL, BCR, what is just what types of the protein kinase and tyrosine kinase, these oncogenes, and translocation of the BCR gene to ABL genes, and these are the protein kinase enzyme. The tyrosinase kinase, I think, যদি এই ক্লাস করেছিল, BCL and BAX able to not regulate it and increase the protein kinase. Ultimately, the anti-tumor drug like STIATO and used for the treatment of the BCR, ABL region or tyrosine kinase. 90% cancer patient respond to the treatment and rapid growth decreases but side effect. So these are the not a protocolic treatment, or just you can see it. How to prevent the heart disease, not this is not required in this class. Is lowest heart disease, eating of the healthy foods, lowest cholesterol, exercise, quite smoking, and manage stress, regular check up, control weight. Not only actually this is not only heart disease but also the cancer can be prevented. You can control it, healthy, lower cholesterol. Okay, thank you, thank you, thank you. If any question, देखो उज्जवल, हेलो उज्जवल.